The World Health Organization defines health as a state of complete physical, mental, and social well-being, rather than the absence of disease or infirmity. Diseases are conditions that interrupt normal bodily functions and can lead to pain, dysfunction, distress, or even death. The CDC defines chronic diseases broadly as conditions that last 1 year or more and require ongoing medical attention or limit activities of daily living or both. Chronic diseases are long-lasting conditions that generally develop and progress slowly over time. They often persist for the entirety of a person's life and may require ongoing medical attention and management. Chronic diseases are typically caused by a combination of genetic factors, lifestyle choices, and environmental influences. Examples of chronic diseases include heart disease, cancer, chronic lung disease, stroke, Alzheimer's disease, diabetes, and chronic kidney disease. These conditions are usually not directly transmissible from person to person. Characteristics of chronic diseases include gradual onset and progression, often associated with risk factors like smoking, poor diet, lack of exercise, and genetic predisposition. May involve periodic flare-ups or exacerbations. Management focuses on long-term treatment, symptom control, and lifestyle changes. Chronic diseases differ from other types of diseases in terms of timing and contraction. Chronic diseases are health conditions that persist over an extended period and often require ongoing medical management. These diseases generally develop slowly and have a prolonged duration, lasting months to years or even a lifetime. Chronic diseases are characterized by their long-term impact on an individual's health, quality of life, and functional abilities. WHO. Unlike infectious diseases, chronic diseases are non-communicable, meaning they aren't contagious. Infectious diseases are caused by the body's immune response to pathogens such as bacteria, viruses, fungi, and parasites. These diseases are contagious, meaning that they can be passed from a vector such as a person, animal, or object. Please see the infectious disease module for more information. Acute events are severe incidents that have a rapid onset and typically last for a short period of time. Example, heart attack, stroke, asthma. Acute events are time-limited and can vary in severity, ranging from mild to life-threatening. It is crucial to respond in a timely manner to acute events to avoid serious complications or even death. Acute events can be linked to chronic conditions or to infectious diseases. However, the effects of acute events can lead to chronic long-term disabilities. It's worth noting that there can be some overlap between these categories. For instance, some chronic diseases can be triggered or worsened by infectious agents, for example, chronic hepatitis leading to liver disease, and certain infections can lead to long-term health problems, for example, HIV progressing to AIDS. Prevention and management strategies for both types of diseases are distinct. Preventing chronic diseases often involves lifestyle modifications, like adopting a healthy diet, exercising regularly, avoiding smoking, and managing stress. Preventing infectious diseases typically involves vaccination, practicing good hygiene, using safe water and food sources, and utilizing appropriate protective measures, for example, wearing masks during outbreaks. Chronic diseases are a major issue in America. They are the leading cause of death and disability and cost the nation $4.1 trillion in annual healthcare costs. Approximately 6 in 10 adults have at least one chronic disease, and 4 in 10 have 2 or more chronic diseases. Risk factors are conditions that increase the chance of developing a chronic disease. Many chronic diseases have multiple risk factors, meaning that there are multiple factors that lead to the chronic disease. Risk factors can be broken down into 2 categories: modifiable and non-modifiable. Non-modifiable suggests these are factors that cannot be controlled, such as genetics. Modifiable risk factors suggest that actions can be taken to change the outcome. Modifiable risk factors are those things that we can change to lower our risk for chronic disease. Essentially, these modifiable risk factors relate to having a healthy lifestyle. Modifiable risk factors include medication management, diet, cognitive novelty, cardiovascular health, smoking, weight management, stress management, exercise, and sleep health. We will discuss in detail several of these in the self-care portion of this module. Non-modifiable risk factors are those that are mostly outside of your control. Biological determinants are non-modifiable risk factors. Family history is your own family's history with a disease. Diseases can run in families for lots of reasons, such as the fact that members of a family tend to eat the same foods, live in the same areas, and do similar things. While you can't change your family's history of a disease, knowing that the disease runs in your family is important. If family members have had the disease, you are also more likely to have it. Genetics is another reason that diseases tend to run in families. While you can't change the genes you were born with, healthy behaviors like exercising, eating a nutritious diet, sleeping, and avoiding stress can change the way your genes express themselves. Age is the single biggest risk factor for several diseases because over time, we tend to accumulate damage to our organs. Think back on your roughest years. Perhaps you had a child and lost several years of sleep and caught every infection that circulated in daycare or preschool. All those little hits we take from rough years tend to add up. Knowing that you have a history of heart disease in your family is important information. You may not control that family history, but you can control your behavior and make sure to screen more often for high cholesterol. So be proactive in learning about family history when it pertains to common chronic diseases and that can inform the need for lifestyle change, health screening frequencies, and the need for health education. Chronic disease doesn't happen overnight. Think of chronic diseases as existing on a continuum. Upstream factors are risk factors that, when left uncontrolled, contribute to the development of conditions that lead to a chronic disease. Midstream chronic conditions are not diseases per se, but they are conditions that can progress to diseases. Downstream chronic diseases are diseases that have no clear start but have lasted at least a year. Chronic diseases lead to death and disability. Let's walk through this continuum in a little more detail. Upstream risk factors are those that influence health. Some of these factors are modifiable, while others are non-modifiable. Social factors and physical conditions in the environment also play a major role in health. Health is associated with where people are born, live, and reside. Biological factors may put some people at a greater risk of developing diseases, such as a family history of breast cancer or cardiovascular disease. However, many chronic diseases are attributed to lifestyle behaviors, such as poor diet, smoking, or inactivity. Midstream chronic conditions are conditions that have progressed to more serious conditions and often lead to much more serious diseases and disabilities downstream in the continuum. Some examples of chronic conditions include obesity, diabetes, high blood pressure, and dyslipidemia. Downstream chronic diseases often lead to death or disabilities. This list includes some of the major categories of chronic diseases and are more of umbrella terms. We will later discuss some of these chronic conditions later in the module. There is no single factor that leads to a major chronic disease. Let's read this graphic from left to right. On the left, health determinants such as genetics, socioeconomic status, or the physical environment can compound the behavioral risk factors listed there in the middle. When left untreated, these intermediary midstream conditions lead to some of the major chronic diseases depicted on the right. As you can see, it is the interplay of these factors that can lead to chronic disease, with many chronic diseases sharing similar risk factors. In summary, chronic disease doesn't happen overnight and can be thought of as a continuum consisting of upstream, midstream, and downstream conditions. There are many risk factors for chronic conditions, many of which are outside our control, such as biological, social, and healthcare determinants. Because non-modifiable risk factors are mostly outside of our control, it is important to address those risk factors we have influence over, which we refer to as modifiable risk factors. In the following videos, you will learn more about self-care and chronic disease prevention by controlling modifiable risk factors.